Hello friends, I hope all of you are in good health, mind and doing well. Myself Dr. Jogendra Kumar Bastia, neurophysician, SKS Neuro Super Specialty Hospital, Hyderabad. Dear friends, I am here today to share with you very valuable information related to the health and neuroscience. And I hope this information will open your eyes and benefit you, your friends, family members, relatives and many other people. Listen the video carefully and get benefited. Neuropsychiatric disorders are very common. People suffering from neuropsychiatric disorders used to suffer for many years, used to take multiple medications and again suffer from the side effects of the medications, and in spite of that only very few will get real cure or real relief. Depression is one of the most common neuropsychiatric disorder. It is very debilitating, and a study shows 1 in every 20 is still suffering from depression. Depression is like a silent star raging within, unseen by the world. It steals joy, dims hope and leaves you feeling lost. But when a young lady with depression become pregnant or planning to become pregnant, or a lady during pregnancy develops depression, the troubles doubles or triples up. The suffering become more and more. Depression during pregnancy can feel like a storm you cannot escape, leaving you trapped and overwhelmed. But what if there is a breakthrough? There is a lifeline that could bring relief without medications. Now comes the RTMS, repetitive transcranial magnetic stimulation, a cutting-edge, non-invasive therapy offering new hope to moms to be. Could this be the game changer for maternal mental health? Let us uncover the truth and bring light to the darkness. Imagine a treatment that doesn't rely on medication but uses the power of targeted magnetic pulses to awaken the mind and relieve the weight of depression. That is RTMS, repetitive transcranial magnetic stimulation. It is revolutionizing mental health, offering hope where it once seemed out of reach. Is this the breakthrough we have been waiting for? Let us explore the future of this healing. To explain how RTMS works excellently in depression, I will give an example citing a beautiful story. The character in the story is imaginary, but it is really based on a true event. The story is about a young girl, Ananya, a 28-year-old, beautiful, vibrant, ambitious young woman with dreams of starting her own business. But life had other plans. After a series of personal setbacks and the constant pressure of work, she found herself slipping into the depth of depression. Her days were clouded with sadness and nights were restless. She was prescribed multiple antidepressants to manage her condition, but the side effects left her feeling numb and distant. Over time, her dependency on medication grew, but the weight of depression still lingered. In the midst of this struggle, Ananya discovered she was pregnant. The news was a mix of joy and fear. While she longed to embrace the motherhood, she was terrified that the antidepressant she relied on could harm her baby. Her doctor also warned of her potential risks to the fetus and suggested exploring an alternative treatment. After consulting multiple doctors, Ananya learned about RTMS. It's a non-invasive, safe and drug-free therapy for depression. Initially, she was skeptical but decided to try it, hoping it might be the solution she needed for her and for her unborn child. The therapy involved short, painless sessions where a magnetic coil was placed near her scalp to stimulate specific areas of brain associated with mood regulation. Ananya was relieved to learn that it had no side effects and was completely safe for her pregnancy. There was a remarkable transformation. Within a few weeks of starting RTMS, Ananya began to notice changes. The dark clouds of sadness started to lift and she felt a renewed sense of energy and hope. Her appetite improved, and for the first time in months, she could enjoy the simple joys of life. As her sessions continued, she regained her confidence and began to prepare for motherhood with excitement rather than fear. Her husband and family were amazed at her transformation, grateful to see her smile again. Then came the miracle of life. Months later, Ananya delivered a healthy baby girl. Holding her daughter for the first time, she could not help but feel a wave of gratitude. RTMS therapy had not only helped her overcome depression, but had also ensured a safe, medication-free pregnancy. Today, Ananya is a proud mother and a passionate advocate for RTMS therapy. She shares her story with other women battling depression, especially those worried about the effects of medication during pregnancy. She tells them, motherhood gave me a reason to fight, but RTMS gave me the strength to win. It is not just about surviving depression, it is about thriving beyond it. My daughter is my miracle, and RTMS helped make it possible. Nina's journey is a testament to the resilience, hope, and the power of innovative treatments like RTMS therapy that can change lives, one pulse at a time. So, my dear friends, RTMS therapy now revolutionizing the healthcare in mental and neurological disorders. I hope this video must have helped you gaining some new information and make this to reach your friends, relatives, and all needy people. Subscribe the video and make it to reach more and more people. If you know anyone with such conditions who need RTMS therapy, you can contact our hospital, SKS Neuro Hospital, Kachiguda Station Road, Kachiguda, Hyderabad. Be alert, be knowledgeable, and be healthy. Your health, our responsibility. SKS Neuro Hospital, Neuro Care Never Weeper. Thank you for your patience.